Thank you for the introduction. Again, my name is Sarah, and I'll be discussing acne and lasers with you all today. Here are disclosures for Dr. Kelly. Acne, as you all know, is an inflammatory disorder of the pilosebaceous unit, and treatments typically include topical and oral therapies, but light and laser-based devices have also been used for decades to treat acne vulgaris. And what's really exciting about light and laser-based devices is that there's been a twofold increase in the clearance of devices for the treatment of acne over the last 5 years. And this point is further illustrated by this study, which provided an update on the use of lasers and light-based devices in the management of acne. And since this was published just 2.5 years ago, there have already been new devices with novel technologies that have hit the market. So given the rise in new products and technologies, our first objective was to identify FDA-cleared devices indicated for the treatment of acne since 2022. And then our second objective was to elucidate clinical evidence for safety and efficacy for each device. We did this by conducting an FDA 510(k) database search using the code GEX representing laser instruments. We then reviewed devices cleared between January 1st of 2022 through the end of 2023. Devices indicated for treating acne vulgaris were included, and those lacking this indication were excluded. And the respective company for each device was contacted using the protocol in the bottom left-hand corner of the screen. The devices were included if the company responded to us, and the provided data and device websites were then reviewed. There were 105 devices on the FDA 510(k) database during our specified timeframe with the code GEX, and of those, 12 were indicated for the treatment of acne, and 7 met our final inclusion criteria. This is a busy slide with our results here, so I'll guide you through it. On the far left-hand side of the screen, you can see the specific devices, and right next to that, you can see the company that manufactures that device. If you remember, our first area of interest was efficacy. There was one device in which we received only short-term data, but even with 5 weeks after treatment, there was a 75% reduction in acne lesion count. For the other devices with long-term data spanning from 12 weeks to 52 weeks, there was at least a 90% reduction in lesion count, and for some that was greater. Our other area of interest was safety. In all the studies we reviewed, there were only minor side effects such as erythema and edema, and there were no serious adverse events reported in any of the studies. Now, as we were going through the various papers, we noticed that there were other metrics that were being discussed in some of the papers, and so we wanted to highlight a few of those metrics here. The first is histopathology, and for some of the studies, they found complete destruction of the sebaceous gland. Others found inactivation of the sebaceous gland. Other studies looked at inflammation and found decrease in generalized inflammation, as well as decrease in specific inflammatory markers. Other studies found decreased sebum output. And then lastly, one study found psychosocial improvement following 3 months of treatment. On the far left, you can see these were 3 devices in which we heard back from the company, but we were not provided data on these specific devices. But we do want to point out that these devices are based off predicate devices, which either these predicate devices or devices that these are predicated on received clearance for efficacy and safety at some point. In conclusion, for efficacy for the devices that we reviewed, for the data we reviewed from each device, those with only short-term data had 75% acne reduction. All devices with long-term data had 90% or greater acne reduction. And of note, there were no head-to-head comparison studies, so we can't say for sure if one device is superior to another. In terms of safety, there were only minor side effects. There were no long-term side effects or serious adverse events in any of the studies. And then for the other metrics where they were reviewed, they saw histologic improvement, psychosocial improvement, and reduced sebum production. Some limitations we wanted to point out was that the absence of data provided does not necessarily indicate that there's insufficient evidence for the safety or efficacy of a particular device, as some companies may want to safeguard confidential or proprietary information. Additionally, the study is limited to medical devices that were cleared only in the last 2 years, so devices cleared before this time frame were not reviewed in our study. And then lastly, the type of clearance submission, whether it be a 510(k) clearance or a de novo submission, may have different evidence requirements and thus different levels of data provided. Thank you for your time and attention.